everyone. Welcome to Wooster Community Hospital Women's Pavilion. We wanted to be able to provide you with a virtual tour since we're not doing in-person tours right now. This is the entrance of our unit. When you arrive to the hospital, you can come in through the main entrance of our hospital, which is located next to the emergency room, Monday through Friday. The doors are unlocked from 5 a.m. to 7 p.m. If you arrive after 7 p.m., we ask that you use our emergency room entrance so that we can serve you quickly. Okay, so now I'm going to let you know how to get onto our unit. So once you get into the hospital, you will be screened by our screener personnel, and they'll be asking you questions related to your health and COVID during the pandemic. We ask that anyone and everyone that enters into our hospital wear a mask. So come prepared for that. If for some reason you forgot your mask, we will have them provided for you. Once you get past the screening personnel, you're going to walk down to our unit, and it is locked. We try to keep all of our babies super safe and secure, so if you were to try to open this door, it won't let you in. So there is a sign over here on the wall and a monitor, and all you have to do is hit this button. Once the secretary sees you on this camera and hears your voice, let them know why you're here, and they'll let you in.
Hi, can I help you?
Hi, we're just coming in for the tour.
Perfect.
Thanks. So throughout this tour, anytime I'm out in the hallway or in the public areas of the hospital, you're gonna see me with my mask on. We have a microphone so you can hear me well and everything like that. However, when I'm in the rooms by myself, I'm gonna go ahead and take the mask off so that this tour is a little bit more personal. These same recommendations are going to be for our patients and their support person as well. It is required that when you're inside of the hospital, you and your support person always have your mask on. Make sure that your mask is covering both your mouth and your nose. However, when you're in your room and it's just you and your support person, you're free to take your mask off. When your nurse or any other healthcare professional come into the room to care for you, we'll have you put your mask back on. That's gonna be the same recommendation whether you've gotten the COVID vaccine or whether you've tested negative. Those are just the current recommendations that we're gonna follow for everyone's safety. Okay, awesome. So this is our family waiting room. Unfortunately, currently we're still restricting visitors in the hospital due to the pandemic. But we're still a very family-friendly oriented unit. So you and your significant other are both welcome. I know that's a big concern of people still. So our unit is a big rectangle. Hi, Susie.
Hello.
So this is where you'll check in after you come in through those doors, and our secretary will greet you. And then you'll be either taken to our OB triage unit, which sits just outside of the Women's Pavilion for further monitoring, or you'll be taken straight to one of our labor and delivery rooms. So our unit has 21 rooms, 10 postpartum rooms, and 11 labor and delivery rooms. So this is one of our labor rooms here on the Women's Pavilion, and I just want to show you around the room a little bit and kind of let you know what you're going to see when you're here. So when you come into our room, you'll see we always have, a chair for you. We actually, in this room, we have 2 chairs. There's a rocking chair in here as well. We have a nice big bed or couch that folds over into a bed. I will show you how that works. We have the stablet that your baby could go to. Now, at Wooster, we actually do an hour or 2 or longer of skin to skin with mom and baby. So after your baby is first delivered, that is kind of what you can expect. The stablet is here just in case we need it. So it provides warmth and oxygen to your baby, but most of the time your baby doesn't go here. Your baby goes right from you onto your chest and stays with you for an hour or 2. then we usually encourage your support person to get some skin-to-skin time in there as well. Your bed moves all around. It can go up and down. It can sit up and sit back. We can even put this bed into a sitting position. But for the most part, what we encourage for you when you're in labor is to be up and moving if you don't have an epidural yet. So we have a lot of assistant devices here and available for you on our unit. One of those is something like this. And I also encourage, if you have not had a baby before, taking one of our childbirth classes, because they will explain a lot of these devices in more detail. But this is a seat that women can sit on. We also have birthing balls that are round that you can sit on. And the new craze is what's called a peanut ball. It's a type of birthing ball. You can sit on them, but you can also put them in between your legs for different position changes, and they've been shown to really reduce C-section rates. I want to tell you too, I like to warn the dads about this because we turn these on at delivery time, again, just in case we need them, but they do have heat and lights, and sometimes they're a little noisy. You might hear them dinging and buzzing, but usually there'll be a nurse here kind of monitoring that. But if you hear a lot of beeping like that, it's nothing to be alarmed of. It's just the normal rings and dings of our warmer. And now it's ready. It says admit baby. So once the baby's delivered, we hit that button and it helps us track things as well. Okay, so this is always a big question that we get. Let me show you how to use the couch for dad. So it's a couch during the day. It's pretty comfy. But then when your support person is ready to go to sleep, it turns into a bed just by pulling on this here. And this will get you sheets. I do recommend, a lot of patients prefer using their own pillows. So if you want to bring a pillow from home, that's totally okay. But this mattress is fairly comfortable. So we've gotten a lot of good reports on that. And then when it's time for it to go back into a couch, it's fairly easy. You just pull the lever. And if I can do it, anybody can. Okay, so all of our rooms have a private bathroom. This is one of our 2 tub rooms. So we have 2 labor and delivery suites that have a built-in bathtub, and I will show you that now. So this is the bathroom. This is one of our bathtubs for laboring. We do not do water births, but we encourage as much hydrotherapy as possible. I get a lot of questions about how do I get in a tub room? So if that's something you're interested in, it's going to be a decision between you and your healthcare provider to make sure that you qualify as far as, you're a low risk, don't have an epidural. If you have more questions about that, feel free to let us know. But just let your nurse know when you arrive to the unit, if you're interested in natural childbirth and doing as much hydrotherapy as possible, just let us know and we'll accommodate as best we can. If for some reason a tub is not available but you want hydrotherapy, there's a shower in every single bathroom, and that as an experienced labor and delivery nurse, it is definitely a good option as well. So one of our goals in the Women's Pavilion is really just to support you during the entire labor process, however best suits your needs. So maybe hydrotherapy and natural childbirth isn't for you. We have lots of other options as well. We can provide IV pain medications. We can provide nitrous oxide. So that is a mixture of a gas and oxygen that you breathe in, sort of through like an oxygen mask. And it doesn't take the pain all the way away, but it does significantly help. So that's an option we're proud to offer here. We also offer epidural anesthesia and have anesthesiologists and nurse anesthetists that are right here in the hospital all the time to, again, serve your needs as best we can. So you will have a nurse assigned to you during your labor and delivery, and we provide one-on-one nursing care. Your nurse will give you her phone number so that you can call her if she's ever not in your room and you need something. That will also continue postpartum. Your nurse will always have a phone number that you know, And you can call her and let her know if there's anything that you or your baby or your support person need. We also set goals so that we know what you want to focus on that day, when you want to go home, and we'll talk more about that in our postpartum suite. We also provide you with the lactation consultant's phone numbers as well. So we understand that not everybody has a vaginal birth and some people might need a cesarean section. So I wanted to take the opportunity to also show everyone our operating room. So we have a C-section room, we actually have two right here on our unit. So if a woman does need a C-section, she stays with us right here in the women's pavilion with the same nursing staff and the same doctors. So because I'm leaving this room, I'm gonna put on my mask and give you a look into the OR. Let's go. Okay, now you're entering our operating suites. You'll see that there's two, just in case we have to do more than one cesarean section at a time. Again, just to reiterate, these rooms are right here on the women's pavilion, so you'll be cared for by the same wonderful staff as you would if you had a vaginal birth. The doctor and the surgeon will put a drape up to kind of block the surgical area. So the nurses and the doctor will make sure that your baby is doing well. They'll dry them off quickly. They may be assessed very quickly on the warmer, and then they'll be skin to skin with you. I wanted to show you guys, we do have actually two different refreshment centers on our unit, one on each end of the unit. We provide some snacks and drinks. We have Jell-O. Our cafeteria does close late in the evening, so we have microwavable dinners and ices. You guys gotta try one of these. They're really good. We have hot water for tea. We do have coffee available at the nurses station. You guys might need that while you're here. And just, again, little snacks like cereals and crackers, and you have availability to a microwave as well. Some people would prefer to bring their own water bottles, snacks, drinks. You can pack up a little cooler, and that is totally okay for you to bring here with you. So we have been recognized by the Ohio Department of Health as being a breastfeeding friendly facility. So what that means is we follow the 10 steps to successful breastfeeding so that we're able to properly support women that decide that they want to breastfeed their baby. All of our healthcare providers are specifically trained. They have many, many hours of education to properly help and support breastfeeding moms. Our goal while you are here in the hospital is to support you in any way to meet your feeding goals. Once you have delivered, whether that be vaginally or by C-section, you will be moved to the other end of our unit to our postpartum area. They have a little bit more of a comfortable bed, and it's a little bit more of a quiet environment, and it just puts you one step closer to getting back home. We do an advanced recovery process here at Wooster. So our cesarean section moms recover very quickly after their C-section, and most of our patients stay in the hospital about 1 to 2 days. I've also gotten a lot of questions about, what do I bring to the hospital? Do I need all of our baby items? Do I need pads and clothes? And the short answer to that is, if you showed up at our doors with nothing at all with you, you would be okay. We provide and have access to anything you can possibly need. Now, most people do like to bring a lot of their own personal belongings with them. Pajamas, your own pillow. You'll definitely want a car seat and an outfit to take your baby home in. But other than that, we have you covered. You may prefer your own toiletries. If there's something that I have forgotten, please feel free to let us know. I can answer any questions about what to bring further. Every one of our postpartum rooms also has your own personal bathroom and the same whiteboards to be in contact with your nurse. You'll have a crib for your baby to sleep in. We do focus on safe sleep here in the hospital, so we'll want your baby to sleep in the crib on their back, and we provide you with a sleep sack for your baby to sleep in as well. We'll provide you with diapers and wipes and diaper cream and everything that you need for your baby as well. And I think that's about it for the actual room. They look and they're set up very similar to our labor and delivery rooms. Every room has a TV, but you'll also notice that you'll be given a folder during your hospital stay. So during your postpartum stay, you're gonna have this folder, and it's got lots of information in here for you, and you'll wanna take this home with you and have it as a resource, but ultimately this booklet, super helpful during your hospital stay and after. It's gonna help you know how to take care of yourself and your baby. We also provide for you. A lot of patients are anxious, like, when do I get to go home? What do I need to do to be able to go home? And we provide for you a roadmap to discharge. So this will be at your bedside, and you can fill it out with your nurses, and it just goes through all of the steps, all of the things we'll be doing for you and your baby during your time here. Now, your baby will get to stay with in the room with you. We do what's called rooming in, so that's why the crib is right here by the bed. We do have a well baby nursery, and we'll show you a glimpse of that as we walk by in the hallway. But I would say most of the time babies aren't in there. Moms want to keep the babies with them. We want the baby to be with you, but we have the nursery if we need it, or we'll do like circumcisions and things like those procedures in the nursery. So these first couple postpartum rooms that we have here, we really try to keep even our special care babies and their moms together as well. So we provide what's called a hotel room. So mom's been discharged, but baby still needs some extra care in our special care nursery. So that's what the rooms down this hallway are for, okay? So we partner with Akron Children's Pediatric Hospital, which allows Wooster Community Hospital to provide a higher level of care for our community members. So because we have an Akron Children's Special Care Nursery on our unit, so it was just one door away, we're able to take care of premature babies, 32 weeks and up. We also can expand our care for some of our moms too. So if a mom is a high-risk delivery and has something like high blood pressure or diabetes throughout her pregnancy, this nursery allows us to care for her baby as well, just in case there's any more increased complications after birth. Your care does not stop here. We have a lot of outpatient services for you as well, especially in the realm of breastfeeding support. So I will show you the lactation office and where we do our outpatient lactation and our virtual telehealth visits as well. Okay, let's go. So this is the lactation room that a lot of women will come back for extra support. As mentioned earlier, we also do virtual lactation appointments as well. We can do baby weights, pre and post feed weights, and just provide that extra support and reassurance that a lot of moms need after leaving the hospital. I hope you enjoyed and found this tour very helpful during the time that we can't do in-person tours. And I hope that you just realize and know that we have a very family-oriented unit with fantastic medical providers, midwives, and nurses. Thanks for choosing Wooster Community Hospital Women's Pavilion.